Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Yes. So in this class, we're going to talk about very important severe acute malnutrition now. Is my voice coming to everyone? There was a small issue which has been resolved. And is my voice coming to everyone? Please put a message in the comment section and then we can start about it. Yes. Okay. Okay. Okay, is my voice coming to everyone? Yes or no? Then only I can start the class. Sometimes from the back end, it gets a small issue here and there, which has been resolved. I guess so. So is my voice coming now? Yes or no? Is my voice coming now? Yes, I think, yeah, it's coming. Okay, great. I think it's coming to me also. So, thanks. Okay, let's start this class. Unacademy is one of the most beautiful platform which helps us in sharing some beautiful knowledge together. And hello everyone. And sorry for the delay because there was some little issue at the back end. Okay, let's start this beautiful class, guys. My name is Dr. Anand. I'm assistant professor in a medical college. Recently we had a beautiful we had a beautiful pack in the Unacademy. Get a 3 months extension on your 6 months subscription, and very beautifully what you call get a 6 months extension on your plus subscription of 1 year and above. Recently we had this pack. I hope you guys have taken it. Our target is now module 1 and module 2 for 6 months and 3 months. We have a subject wise very beautiful what you called batch, and then we have the high yield revision batch for the PG students. Good evening everyone. I'm so sorry to keep you waiting. I mean there was some issues, sorry. Hello Osama bro, hello everyone, Manish, and so many people are there. Yeah, let's start this class. Educators are amazing in Unacademy, and we have this discussion batch for the pertaining to 2023, and this is in June month and for 9 months. In the Unacademy we have plus iconic light MBBS prof 1 and UPSC CMS what you call pack exactly, and these are the beautiful prices and the amazing durations. Today's topic of choice, we're going to talk about malnutrition, a very important topic. Malnutrition. Manish says here's some beautiful people taking classes. Manish, thank you. So sweet of you, bro. Thanks a lot. Thank you, thank you, thank you, thank you, thank you. Sometimes blessings plays a very important role, and you are one of the important example of that. So yes, in the beautiful pack of the Unacademy, the topic of choice is severe acute malnutrition. Quick discussion because we already late. Let's talk about it. Before starting any amazing segment, we always have a motivating quote. And today's beautiful motivating quote is, if you don't sacrifice for what you want becomes the sacrifice. See, sacrifice थोड़ा बहुत तो करना पड़ेगा. Hard work will be important. Hard work, smart work, dedication, consistency, all these words which we hear in some here and there novels and stories, they are very well worth and they are really very important. So moral of the story is, if you don't sacrifice for what you want becomes the sacrifice. Today's topic of choice is malnutrition, and yes, this is the first amazing question I have it on malnutrition. Malnutrition has been a very important topic for our recent FMG students. Back to back in the continuous exams for the FMGs, we are having questions on malnutrition. Now can we please talk about it, bro? This baby, can you please name, what do you call this baby? Baby number A is also malnourished and baby number B is also malnourished. But can we talk about it, like what do you call them? Exactly, baby number A is nothing but known as marasmus. Whereas what is the baby number B? The baby number B, the fatty baby, the heavy baby, is known as kwashiorkor. Spelling याद रखिएगा, end में KOR आता है. Kwashiorkor we say in the spelling, in the speaking sense, but it is kwashiorkor. Okay, remember that. Exactly. So, Hanji, doctor, very well put by Dr. Suman. How the marasmus? S for marasmus, S for the skinny baby, and opposite of that is kwashiorkor. Opposite of that is kwashiorkor. Now, could you please tell me, like, अब देखिए ये बच्चा भी SAM में आता है. This baby is also a case of SAM, and this baby is also a case of SAM. Could you explain me why? Why ये सूखा बच्चा भी सैम में आता है और मोटा बच्चा भी सैम में आता है? Can anyone answer in the comment section? Himani, Osama, Suman, beautiful, our Manish, Priya, Shubham and Swaraj. Yes, the best answer for this question is marasmus. See, marasmus is deficiency of calories plus proteins. According to latest guidelines, marasmus is deficiency of calories plus proteins, whereas kwashiorkor is only and only. Okay, very importantly, straight away, marasmus is deficiency of calories plus proteins, whereas kwashiorkor is isolated deficiency of proteins. There is hypoproteinemia, basically there is decreased serum albumin in a case of kwashiorkor, very importantly, and hypoalbuminemia obviously leads to anasarca, or nothing but generalized body swelling. Remember, this baby who's having a generalized body swelling is kwashiorkor, and the skinny baby is very importantly marasmus. Second very important point. Yes, exactly. Okay, Dr. Shubham, is my voice coming to everyone? Dr. Shubham is getting the video is getting stuck. I hope my voice is coming. Let me know if it is coming. Okay, put a like button. Hanji, one more point I would like to revise in my notes over here is very importantly. See, marasmus baby, they look very skinny. They look very skinny, but they have, can I write over here? They have voracious appetite. Very, very, very important. Marasmus baby लगते सूखे हैं पर खाते बहुत ज़्यादा हैं. Marasmus baby looks very skinny, but they have voracious appetite. Whereas on the other hand, bro, kwashiorkor baby, they look very fatty, but they have apathy. They have apathy. Okay. Very, very important. Remember that. Okay, very beautiful. So can we please revise? Number one, see, we are studying the topic of choice is SAM, severe acute malnutrition. Point number one, the baby who is very skinny is marasmus. The fatty baby is kwashiorkor. Marasmus is deficiency of calories plus proteins, whereas kwashiorkor is deficiency of only proteins. Serum albumin will be definitely low in a case of kwashiorkor, and they look very skinny. Marasmus baby look very skinny, but they have voracious appetite. खूब खाते हैं, लगते सूखे हैं और खूब खाते हैं. ओसामा जैसे सूखा हड्डी जैसा है ओसामा हमारा, लेकिन खाता खूब है ना ओसामा. And whereas kwashiorkor baby, they look very fatty, but they have apathy. They have apathy. Okay. And one very, very important point: how do you diagnose a case of that this is a kwashiorkor baby or this is a marasmus baby? The most beautiful answer on this planet is that SAM is a clinical diagnosis. SAM is a clinical diagnosis. Anyhow, we have the WHO classification of SAM, that is a classification, but in general diagnose that this baby is this. I told you that kwashiorkor is having hypoproteinemia and definitely serum albumin will be low. But do you diagnose on the basis of serum albumin? No, no, no. You diagnose clinically. Mota bachcha kwashiorkor, sukha bachcha marasmus. So SAM is a clinical diagnosis. That's very, very important. And Dr. Suman is telling one very beautiful point. We must appreciate that point. One thing you remember, I would like to tell it. कहाँ लिखूँ मैं, जगह ही नहीं है. Okay, so marasmus and kwashiorkor. Marasmus and kwashiorkor. The one very, very important point is marasmus baby. As I told you, they look very skinny. As I told you, they will have voracious appetite. This point I have told you. And one very, very important point. I go to gym. And most importantly, if I stop eating, what will happen? If I stop eating, my carbs will break down, my proteins will break down, and my fat will break down, right? This is a normal physiological process. So what I'm trying to say is, if I give insult to my body, insult as in I am starving or I'm going to gym but I'm not eating anything, my carbs will break down, my proteins will break down, my fat will break down. It's a normal automatic process because I'm giving insult to my body. I'm going to gym and I'm not eating anything. So what do you call this? ये हो क्या रहा है यहाँ पे? Now this is known as very important theory of adaptation. Please remember, there is something known as theory of adaptation. Please remember. Okay, yeah, the video I think might be getting stuck. Okay, so please remember, there is something known as theory of adaptation and there is something known as theory of disadaptation. Please remember one very important, yes, very well put point, beautifully point has been put by Dr. Shubhangi Kaushik. So if I stop eating, my carbs, my protein and fat will break down. My body, that means my body is adapting to the insult which I'm giving to my body. This is known as theory of adaptation. Whereas Kwashiorkor baby also don't eat anything. Sam, hai na, they don't have food and they are starving and all that, but they are like fatty baby. So Kwashiorkor baby has follow a theory of disadaptation, and whereas very importantly, Marasmus baby, they follow the theory of adaptation. Has everyone understood this much? Yes or yes, yes? Hmm. Is my voice coming to everyone? If the video is getting stuck, let me know. I will switch it to 5G in my internet connection. If my voice is coming, that fair enough. Okay. Next important point. Now the next important point is, how do you classify and define SAM? This is a very important NEET PG question, as well as this is a FMG question. In the FMG exams, back to back, every year they are asking a question on SAM. Every year they are asking a question on the SAM. Okay, perfect. So now point number one, how do you classify and define SAM? Okay. एक्चुअली मैंने शाम को ना एग खाए हैं 5 eggs, तो आई एम गेटिंग दिस नॉजिएटिंग फीलिंग। आई बहुत ज़्यादा अंडे एक साथ मैंने बहुत अंडे खा लिए। ओके, हाउ डू यू क्लासीफाई सैम? WHO classifies SAM as very important. Yes, very good, Dr. Osama, very good. Weight for height less than minus 3 standard deviation. Point number one, very important. Weight for height less than minus 3 standard deviation. Mid upper arm circumference 0.5 centimeter, and with and without edema. Very important point. Yes, exactly. Okay, so yeah, so please remember, the WHO defines SAM as weight for height less than minus 3 standard deviation, mid upper arm circumference less than 11.5, with or without edema. Okay, this is a very important point. This is important. Okay, don't write weight for age or height for age. It is weight for height, double star mark. 20 times this question has come in the exams. Okay, please remember. Okay, perfect. We have various classifications of SAM. We have WHO, IAP, Waterloo, Gomez and Udani classification, but we follow the WHO classification. Yeah, the video getting stuck. Let me just shift to 5G. Switching it to 5G. अभी आ जाएगा, अभी connection आ जाएगा. Exactly. I think now it is coming. Okay. Is it coming now? I think now it is coming. Okay. So yeah, that's it. So mid upper arm circumference. One important question we were asking, how do you take the mid upper arm circumference? Mid upper arm circumference is a very mid upper, this one. Okay. Mid upper arm circumference. Mid upper arm circumference is the midpoint of two things they ask in exam. Number one is the acromion process, and number two is the olecranon process. Very important. The mid upper arm circumference is a midpoint of the acromion process and the olecranon process. That is one very important point. And which is the important tape do we use in a case of what you called, yes, on a case of a SAM? This it could be a very beautiful, very easy and very amazing question. Identify the instrument shown in the picture. This is nothing but anyone. This is known as Shakir tape. This is known as Shakir tape. Shakir tape, basically it is used to diagnose SAM, and we have three colors. Can we see the red? Can we see the yellow? And then can we see the green? Very important. Red, yellow, green. Red, yellow, green. Okay. Exactly. And how do you take it? I'll show you a very beautiful picture. 1 second. Yes. Now, can we appreciate this picture? Yes. Is my voice coming or is it getting stuck? I think now it is coming, right? Now, yes, this is nothing but very importantly Shakir tape, and we have the red color, we have the yellow color, and then we have the green color. Very important. If I am having the red color in my Shakir tape, my MUAC is less than 11.5. If I am having the Shakir tape, the color is coming yellow, my MUAC should be less than 12.5, and if it is more than 2.5, the color must be green. Good to go. G for green, G for good to go. Okay, remember that. Red, yellow, green. Red, yellow, green is very, very important. Yes, except the blue color of the Ludo. Very well put, Dr. Suman. Very beautifully. Perfect. So we have severe malnutrition, moderate malnutrition, and mild malnutrition. That's very well put. Okay, let's quickly revise because the video was getting stuck. That's why we should revise. Severe acute malnutrition. In the case of Sam, we understood the skinny baby is nothing but marasmus. S for the skinny baby. The fatty baby is the kwashiorkor. And we also understood Sam is a clinical diagnosis. They look very skinny, but they have voracious appetite, and they look very fatty, but they have apathy. And for the newcomers, we have done this very important, this voracious appetite. और कहाँ पढ़ा है हमने? Dr. Haider, Amrit, Dr. Shubham, yes. Where else have we read the what you called voracious appetite? Yes, very good. The beautiful answer is nothing but congenital hypertrophic pyloric stenosis, CHPS. In a case of congenital hypertrophic pyloric stenosis, the patient will have a voracious appetite. Then also we understood, okay, anyone, Sam is common in boys or it is common in girls? What do you think? Anyone, any random guesses you want to put? Sam is common in boys or girls? Dr. Amrit says less than 11.5 is valid till what age group? 6 months to 5 years. 6 months to 5 years, the mid upper arm circumference remains constant. 6 months to 5 years, the mid upper arm circumference remains constant. तो तब तक हम लेते हैं डॉक्टर अमृत. ओके, अच्छा, सब कह रहे हैं लड़कों में कॉमन है. अच्छा जी, लड़कियों में कॉमन है. ठीक है. इन द गर्ल्स इट इज वेरी कॉमन. सैम इज कॉमन इन गर्ल्स. व्हाट अबाउट रिकेट्स? एनीवन? Rickets is common in boys or girls? Anyone? Any random guesses? Mm-hmm. Hmm. Exactly. क्या हुआ ये? Yeah. And rickets is also very common in girls. Rickets is also very common in a case of girls. Rickets also is common in girls because many of the communities we have parda system, and then females are not able to go the exposure of the sun. So yeah, rickets is common in girls, and very importantly, SAM is also common in girls. Then we covered the classification of SAM. This is a very important slide, and this is a very important point. Out of 10, 7 students do mistake in this. Okay, if I ask them how do you define SAM, they say something else, but the answer is weight for height. And could you please tell me how do you define AGA? What is AGA and how do you define AGA? Yes, Dr. Shubham says अच्छा नहीं लग रहा हर टाइम बेचारी गर्ल्स क्यों? ये तो मुझे भी नहीं पता, लेकिन sometimes in communities, some communities have this problem. Exactly. Hanji, how do you define AG? Can we have a very beautiful answer? How do you define AG? Anyone? Mm-hmm. Hmm. Okay, yes. Okay. See, such a Priya says AG is weight for height. तभी मैं बार-बार रुक के पूछता हूँ. Okay, okay. Amrit, Dr. Amrit has the right answer. AGA is nothing but very important, appropriate for gestational age, point number 1. And how do you define AGA? It's nothing but weight for age between 10th and 90th centile is AGA. Okay, now okay, remember weight for age. मैं बार बार पूछता हूँ, I ask multiple times because we do end up doing mistakes. That's why I'm asking multiple times. So please remember, AGA, SGA, LGA is about weight for age, whereas SAM is weight for height. Remember. Okay, has everyone understood this much? Oh, yo, I had so many eggs and I'm feeling so uncomfortable. Okay. Okay, let's go further. Okay, 5 more minutes, then we're gonna end up this class. Hanji, now tell me. So as everyone knows, let's just discuss about it. Okay, this, as everyone knows, this is a marasmus baby, and this is the kwashiorkor baby. Marasmus baby and the kwashiorkor baby, right? Now this is the A and this is the B. So let's solve the whole scenario. Yes, edema is common in A or common in B? Quickly, can we answer this very quickly? Yeah, edema, obviously it is common in kwashiorkor. It is common in B. Perfect. What about activity? Who is more active? A or B? Anyone? Quick answers, please. Yes, number A is more active. Marasmus look very skinny, but they are very active. They have voracious appetite. And Kwashiorkor having apathy. Apathy. Appetite is common in A or B. Obviously, it is common in a case of what you call this one A. And very important, okay, liver, fatty liver. Where will you see fatty liver? Anyone? Where will you see fatty liver? A or B? Kwashiorkor babies. Kwashiorkor's baby will have fatty liver, whereas marasmus baby will have a shrunken liver or atrophic changes in the liver. Kwashiorkor baby will have a fatty liver. Fatty liver बुरा होता है ना? Remember, okay, remember one thing, okay, fatty liver is a bad thing, no? Fatty liver is a bad thing, fatty liver is a bad thing. So Kwashiorkor babies are more sick, no? That's why. Hanji, infections is more common in A or B? Quick answers, please. Infections will be common in B. As I have told you multiple times, Kwashiorkor baby, they look very fatty, but they have apathy. They will not eat anything. They will have late recovery. They will have more mortality, then they will have more infections. Are you understanding, guys? Did we understand this beautiful point? Can we move on? Please put a like button, like tell me in a giving a yes comment that you understood this much. Yes, perfect, very good, perfect. Okay, 2 3 more questions, then we're gonna wind up this class. Exactly. So now could you please tell me the triad of Kwashiorkor and triad in a complication of SAM? Nice question actually. अगर मोटा बच्चा आएगा, if the Kwashiorkor baby will come, how, what is the triad of Kwashiorkor? So please remember, hypoglycemia, hypothermia and infection. Hypoglycemia and hypothermia and infection is the triad of the complication of SAM. किसने बताया ये? Dr. Shubham. Hypoglycemia, hypothermia and infection. Okay, remember that. And where do you see hypoglycemia and hypocalcemia? Hypoglycemia and hypocalcemia is seen in what? Anyone? Yeah, the answer is infant of diabetic mother. Infant of diabetic mother will have hypoglycemia and hypocalcemia, whereas hypoglycemia, hypothermia and infection definitely you see in a case of Kwashiorkor. Okay, and quickly, very quickly, please, hypoglycemia cutoff, hypothermia cutoff. Can you please tell me, anyone? Where is my rant tag? Yeah, I must have a rant tag, otherwise it will be a big problem for me. कभी कहते थोड़ा आराम, मम्मी सही कहती है, आराम से खाया कर, एकदम मत खा जाया कर सब कुछ, बड़ी प्रॉब्लम होती है यार। Exactly. Less than 45 mg per dl sugar is neonatal hypoglycemia, and less than 54 mg per dl sugar is hypoglycemia in a case of severe acute malnutrition. That is the first point. And hypothermia 35.5, less than 35.5 rectal, less than 35.5 rectal, and less than 35 degrees Celsius axillary temperature is the hypothermia cutoff in a case of SAM and then infection. That's it. Perfect. ठीक है, हाँ जी, axillary, हाँ, Osama, you are right. Osama, you are very right. Perfect. And yeah, and remember, I told you less than 36.5 will be neonatal hypothermia. 36.5, 35.5, and 35. Less than 36.5 is neonatal hypothermia cutoff. Less than 35.5 rectal temperature is a cutoff in SAM hypothermia. And less than 35 degrees Celsius is the axillary temperature cutoff in a case of अपना SAM baby. ठीक है, done. This part is over. And what is the triad of this one? ये तो हो गया triad of complication of SAM. This was the triad of complication of SAM. That if a SAM baby is coming with hypoglycemia, I assume the baby will be very cold, and I assume the baby will have infection. Okay? Yeah. Okay. And very important, Dr. Osama has very beautifully told that the triad of the kwashiorkor, mota bacha hota na, mota bacha will have edema, of course. He will have apathy, right? Apathy. So can I link that someone who's not eating, he will have growth retardation, and definitely he can have mental changes. So growth retardation, mental changes, and edema is the beautiful triad for the kwashiorkor, whereas hypoglycemia, hypothermia, and infection is the what you called apna triad for the complication of SAM. Has everyone understood this much? Yes or yes? Okay, okay. Exactly. Very good. Very good. Perfect. People are answering so good. Very nicely answering. Yeah, it's now we're gonna end up this class now here only. Tonight we have a class at 11 p.m. Tonight we have a class at 11 p.m. We're gonna continue this topic of severe acute malnutrition, and there we're gonna talk further about it because I'm having this little gastritis. मैंने अंडे बहुत ज़्यादा खा लिए. I had too much of eggs and now I'm feeling little uncomfortable. That's why. Okay, so tonight 11 p.m. Okay, now we're gonna talk about it. And Dr. Wafa Hussain says hypothermia again, please. Hypothermia, Dr. Wafa. Remember one thing, less than 36.5 degrees Celsius, less than 35.5 degrees Celsius, and less than 35 degrees Celsius. These three things I want you guys to remember. 36.5 degrees Celsius to 37.5 degrees Celsius is the normal temperature of a newborn. The normal temperature of a newborn is 36.5 to 37.5 degrees Celsius. Anything less than 36.5 is known as neonatal hypothermia. Is known as neonatal hypothermia. And less than 35.5 degree and 35 degree, these two we are talking in a case of SAM. This is the rectal temperature cutoff for hypothermia, and this is the axillary temperature cutoff for hypothermia in a specific case of SAM. Okay, that's it. That finishes this today's class. We're gonna wind up now. Thank you so much everyone for this wonderful participation. See you tonight at 11 p.m. class. I think we have to continue the topic of SAM. Yeah, that's it. And in the night class, we're gonna talk about various things like flaky pain dermatosis and flag sign, and then we're gonna talk about complication of SAM and various cutoffs of the SAM with all the treatments. Okay. Thank you so much everyone for this wonderful participation. See you tonight at 11 p.m. Take care and bye.